the most common types of cancer affecting women worldwide. Yet when detected early, it is also one of the most treatable. At Memorial, breast cancer care unites experts across disciplines to deliver precise and compassionate treatment.
Hello, I'm Professor Dr. Serkan Keskin. I work as a medical oncologist at Memorial Şişli Hospital. In this video, I would like to give you a brief overview of the modern treatment of breast cancer. Breast cancer is a very common type of cancer. Statistics now show us that 1 in every 8 to 10 women will face breast cancer at some point in their lives. We know that 30% of all female cancers are breast cancer. The treatment of breast cancer has changed and advanced a lot nowadays. In the past, unfortunately, we used to remove the entire breast of women diagnosed with breast cancer through surgery. However, today we prioritize and consider breast-conserving surgeries. In other words, removing the entire breast through surgery is now a thing of the past. This has been made possible by today's modern drug treatments. When we encounter a breast mass, we do not immediately recommend surgery to our patients. We absolutely need to perform a biopsy beforehand. We plan the patient's treatment based on the results of this biopsy. First, we successfully use neoadjuvant therapy, drug treatment before surgery, immunotherapy, and treatments combined with targeted therapies in the treatment of our patients. This allows us to control the entire body with medication at an early systemic stage, and at the same time, it helps shrink the mass in the breast. And more importantly, nowadays with modern treatments, we are able to preserve the axilla, that is the armpit area. In other words, we only remove the mass in the breast and just sample the axilla. We do not remove the entire breast or the entire axilla surgically. This has been made possible by today's modern drug therapies. After drug treatments, we complete our therapy with radiotherapy. Breast cancer is no longer a single disease. It is mainly divided into 4 subgroups: luminal A, luminal B, PR2 positive, and triple negative. The treatments for these are also different from each other. We do not use chemotherapy for every patient. Sometimes we successfully use smart pill therapies, sometimes targeted drug therapies, and sometimes immunotherapy in the treatment of these patients. And in some subgroups, the rate of complete pathological response without surgery has reached as high as 80%. This is made possible by today's modern drug therapies. All the drugs available worldwide are now also available in Turkey, in Istanbul, in our country, and in our hospital. We do not experience any problems regarding access to or administration of these treatments. We successfully administer drug therapies to both patients coming from our country and those coming from around the world, and we plan the treatments for all our patients by considering them as our guests.